All right, morning everyone. Thanks for joining us today. If you are new to our group, welcome. This is a great organization to be a part of. One of the most important things of our meetings is that the bathrooms are out the back and down the hall to the left. Feel free at any time to get up and use the restroom. There is also a very hard and fast rule about no food or drink in the auditorium, not even bottles of water. So please put them away now and don't open them while we're in here. Afterwards, we'll have a little bit of a lunch, and so please don't bring any of the food back in here. And special thank you to the Sanford Burnham Prebys Medical Discovery Institute. If it wasn't for their generosity, we would not be able to meet here every month like we do. And I would like to make a special call out to Samara Cohen. Yeah. She has been the liaison to us, helping us out tremendously. She's here before every meeting. And she will be retiring from SBP fairly soon. So we are looking forward to meeting her replacement, and hopefully that person will be as supportive as Samara. But she has done a great job for us. Couldn't have had these meetings without her. Round of applause, please. As for the principles of the organization, we are still looking for a more permanent president. I'm filling that position at the moment, and I'm also the facilitator of the meetings here. We have Jean Van Vliet, who's a director, Bill Manning, a director and video editor. We have John Gottlieb, the treasurer, Steve Pendergast, secretary and newsletter editor, John Tassi, our webmaster, and Bill Bailey, our librarian. And of course, there's you, all of the different volunteers. We have Phil here at the door that has set up the luncheon today. A very big job. He is here before I am. He is typically here after every one of you. So please give him a hand right now. And also, please feel free to give him a hand bringing something in from his car, taking it back out, cleaning up. You know, he really is putting in a lot of effort here, along with his buddy Mike. How many newcomers do we have today? Wonderful, thank you. Welcome. Hopefully, you all got a newcomer. Actually, I don't think we have the packets anymore. Just the cover sheet to fill out. So, did anyone not get a cover sheet to fill out? Please raise your hand over here. So please do fill those out, return those to me at the podium here. Take a minute to chat about your case with me at the end of this meeting. What I do also recommend is that you sign up for the email announcements using this Contact Us link. You can find that easily through our website. That will just get you on all the mailing lists, get you emails on the newsletter, and so forth. Hopefully, I will get a chance to give you a welcome call. I've been a little bit overwhelmed, partially by the number of new members. It's been great, but that's why it would be important to come up here, just chat with me for a minute at the end, in case I don't get a chance to give you a call later in the week. So how many here, we've seen how many are here for the first time. How many have been recently diagnosed? And thinking about what to do next? Wonderful. How many have had prostate cancer for less than 1 year? Go ahead and raise your hands. Okay, 1 to 4 years. A few more. 5 to 10 years. 11 to 15 years. And who's going to be our longest person today? Larry. How long has it been?
Since, let's see, 16 years.
16 years. So and Mike, 19 years. Ah, he's got you edged out. Right. For all of you newcomers, the thing to remember is that this is a disease that you can live with, that you can treat, you can get beyond, you can live with it for a very long time and have a wonderful life. You know, the best outcome that you can have is to die of something else than prostate cancer, and that is the goal. So, you know, I can be a little bit tongue-in-cheek in some of this stuff, but like, you know, this can be a serious situation, but hey, this is life, and let's find a moment of levity when we can. Now, for this next summary, one of the key things here is that if you're thinking about pursuing one of these treatments, look around the room, look at who's picking up, raising their hands, and go up to them later on and start a discussion and say, hey, what did you think about this treatment or that treatment? You know, here's my case. Share some details about yourself. Ask those people, ask those members for their advice. So how many people have been on active surveillance? Quite a few. How many have had surgery? Quite a few. How many have had radiation, whether it's proton, photon, et cetera? How many have been on ADT or hormone therapy? How many have had chemotherapy? Nobody today. That is a rather, oh, yes, here. It is less common, partially because these other treatments are really pretty amazing. Radiation and hormone therapy together is a very popular way to go and can result in being in remission for many years, as can the other treatments too. Who has had focal therapy, whether HIFU, laser, cryo, or the new TULSA? We have a couple people here. Those are becoming definitely much more interesting at earlier stages. How many have had new treatments, whether it's immunotherapy such as Provenge, Xofigo, Pluvicto, et cetera? We have a couple. In fact, next month we'll be having a talk on Provenge. Dr. Data will be here with Dendreon to speak about Provenge. And how many have had recurrence? That's a big reason why a lot of people are here. Yes, we can overcome it for many years. Sometimes it does come back, and we have to figure out what to do. And how many are undecided on their future treatment? That's okay. Yeah, that's also why we're here. Now, our support to you comes in the way of several means. Our website, which hopefully you've all seen, has a fantastic amount of information on there, especially for the newcomers. Please check that out. Go to the resources section. There's a number of articles to read, some links to other websites to get the information that you need. We also have nearly every one of our meetings recorded and posted on YouTube. On occasion we can't. I think next month we will not be, possibly not recording that meeting, so the only way that you're going to get that info on Provenge is to have your butt in the seat. The meetings are on the third Saturday of every month, but watch the website in case there is any schedule changes. And we also usually send out a newsletter. Now, many of you might have been noticing that we haven't had the newsletter in a little while. Our main news editor, Steve Pendergast, has been in need of a little bit of support. He's going through some treatment for some eye issues, and it's a little bit harder for him to edit the newsletter. So especially if anybody has any experience with Microsoft Publisher or is willing to proofread, et cetera, please get in contact with me. My email address will be up here in another couple of slides. Please offer your assistance. If we can't get internal assistance on trying to get that newsletter back up and running, we might have to hire outside of the organization, and certainly we would not like to add that expense to us. So please do consider providing your support in that way. As I was saying, we do need volunteers, especially for the newsletter. It would also be nice to have additional people signing up meeting guests. I do get a number of very good suggestions. I'm going to pursue another couple of those that I have to hopefully bring them in as speakers early next year. But, you know, there's a little bit of legwork that goes into that, you know, contacting the doctor, you know, reviewing what they might have to say. And it would be nice to have someone, especially if you are interested in hearing something from a doctor, even if they're way out in Texas, like the Tulsa Pro doctors were. Okay, we can bring them in by way of Zoom. If you don't get a chance to be able to go and see that doctor, having them either come physically or remotely to talk to us is a great way for you to get FaceTime with that doctor. It is an option for you. So think about any limitations you have, and maybe this organization by that way can help you out with that. And of course, we need a backup meeting facilitator once in a while. John Love has stood in for me, which is wonderful. And that might just happen 1 or 2 times a year. Believe me, this isn't too hard to come up and do once you've thought through the presentation a couple of times. we're only asking for a couple, 2 to 4 hours a month. And that's not a whole lot, especially when you consider the amount of time you might spend reading a pathology report and trying to interpret that. So please do try to give back to the organization in that way. So there is my email. Make the subject IPCSG volunteer so I can more easily go back in time and find all of those wonderful emails when I do need you for something. Okay, sorry. Bear with me a little bit. I'm a little bit tired from traveling this week. I might stumble over my words and forget a few things, but yeah, I was just checking to make sure I had the right slide. How many people attended the recent PCRI conference up in LA? Wonderful program from what I heard. I expect that you all learned a lot that went. That is a great, very low cost conference that you can attend. They have it every year. I will advertise it again next year ahead of time. I'm not sure, does anyone that went know if they will be posting videos of all of their sessions online?
They said they were going.
Okay, all right.
It's in a couple of weeks.
Excellent, excellent. So yeah, if you missed it, look for the videos online at their website. There is also an upcoming fundraiser here in San Diego. Unfortunately, it is on the day of our next meeting, but one of our past speakers from Telix Pharmaceuticals is a sponsor, and they asked me to let everybody know about this event. Zero is an organization that is also backed by some big pharmaceutical companies and stuff. Please consider giving your support, especially since this is one of the speakers that has come to us to support us. Now, our support group purpose is we share patient-focused experience on becoming your own case manager through informing, networking, and caring. We are a group of experienced participants, but we are not medical professionals, and any sharing of anyone in our group may not be a substitute for your medical counsel. And we do need your support. John, Mike, would you please pass around the baskets? We are a 501c3 nonprofit organization, and our donations are tax deductible. We have no medical or religious affiliations. And the organization does have a number of costs. While we do get this auditorium graciously for free, we do have costs when it comes to keeping the website up and updated, getting the videos up onto YouTube. We used to have mailings. Hopefully now that's all emails. Occasionally we will advertise for the group. And sometimes we give donations, such as to PCRI, who in exchange give us a reduced registration. Please do consider donating to the organization. If you can't do it today, you can send a check to the address that you see here. There's also an online PayPal link. Of course, the checks are preferred so that PayPal doesn't skim off a little bit along the way. It's a small amount, but every little bit helps. So thank you for those donations. As I mentioned, next month we'll have Dr. Paul Dato from Unios Specialty Care. He'll be speaking on Provenge, and that meeting is going to be sponsored by Dendreon. That's on October 18th. And in terms of other upcoming meetings, what topics would people like to have? In November, we'll actually have Bill Manning here to talk about active surveillance. In January, I'm in the final stages of verifying confirming that Dr. Munt will be here again for an update on radiation. We've had a couple of talks on focal treatments this year. We've had a roundtable. The biggest suggestion that I've had is to bring in a doctor that specializes in sexual health, sexual wellness. As we all know, that is a large concern of people undergoing prostate cancer treatment. So I will be pursuing somebody like that. Does anyone have any other suggestions or ideas of topics that they would like to?
You had immunotherapy?
So Provenge is a type of immunotherapy, I believe.
So,
They'll be next month.
yeah.
Yeah. And I'm not as well versed with some of the more advanced stuff, but I'll look into seeing what other things there are. I know that Dr. Lamb sometimes touches on the more advanced therapies as well, and he'll be coming in, I think, mid-2026. Okay, but I'll look into that one some more too. Any other requests or?
About an oncology social worker to see how they can help with our patients.
I don't even know that person existed. So,
Shout it out today.
yeah, okay, an oncology social worker. I should have, had that person join us today too, right? Yeah, maybe during, pardon me, I'm at a loss for words at times. Maybe during one of our next roundtables, we can also have an external person come in to supplement those talks, such as the oncology social worker. That would be good. Do you have contact info for one at Scripps and UCSD? Yeah, so maybe we'll have a meeting like this in the future with those two individuals. Okay, great, thank you. Okay, so for today's meeting, we have patient and nurse navigators from UCSD and from Scripps. We're going to start with Paula Robins and then followed by Christina Cortez. So let's give them a nice welcome. So Paula, come on up.
Thank you, Aaron.
And I'll leave this on if,
Inviting us.
sure thing. And
Thank you.
I'll leave this on in case you want to walk around with it.
Okay.
Oh, sorry, let me get that going. That look good?
That looks
And
great.
that-
Thank you. Good morning. It's a really different perspective being on this side than from being on the other side. There's a lot of eyes looking at me. And usually I'm one-on-one, so just send good energy this way. So it's a different perspective, and I imagine for most of you, it was a change of perspective when you were first diagnosed and when you went on your pathway to determining what was the best treatment for you, or you're on that pathway now. And when you're doing anything new, it's always good to have a guide. So good morning, my name is Paula Robins, and I'm a patient navigator at UCSD. I work in the urology department there. And you might say, what is a patient navigator? And I'm really glad you asked. So a patient navigator can help you navigate healthcare systems by providing personalized support, education, information, guidance to not only help patients but their families, because as you know, prostate cancer doesn't just affect the patient, it affects their family, their friends, the next pathway of their life. So it's good to understand your medical conditions and your treatment options. At times you may have had the experience where you met with your provider or doctor and all you heard was the word cancer, and come back and let me know what you'd like to do about it. So understanding what those options can be, understanding your resources, that's why the navigators are there to help you navigate. I mean, what a great word that is, isn't it? Anyway, we can help you overcome barriers to care that can be financial situations, transportation, knowledge, what are good resources, and advocate for your wants and needs. We have the ability to reach out to the providers, maybe get a little quicker response than you visiting every couple of weeks. So navigators are very useful, and I think we do a great job. And at UCSD, we not only have, I work in the urology department, but in Moore's Cancer Center, we also have a navigation department that helps when you're on the oncology side of it as well. And we have social workers that help with that as well. So how did your prostate cancer journey begin? When did you first? Yeah, that's it. I just want them to think about that. When did prostate first enter your vocabulary? For most men, that's not something that they much thought about. And generally, men are the stoic ones, the quiet ones, maybe the head in the sand for healthcare. And learning about what a prostate is comes as a big surprise. Maybe that started with urination difficulties. Maybe it started with having your PSA tested. So for everyone, it's a little bit different journey on that. So just wanted to ask you a couple of questions, and anyone can answer. Does anyone know what a prostate is usually compared to in size or shape? Anybody? A walnut. All right, good. And what size is a prostate, a normal prostate size?
Like 50 cc's,
Well, you're pretty close.
35.
Closer. So think of a walnut, but I've also heard the prostate described as an orange because you're talking about the shell, so and the fruit that's inside. And also if you're having a biopsy, you're talking about cores. So I think about it as an apple, but it's really a gland, and a normal size is about 30 cc's. As we have more candles on our cake, what happens to that prostate? It grows like our ears and a few other things. That's exactly right. Where is PSA produced? What produces PSA? Oh, come on. Who said prostate? That's a good shirt for him, too. He should hold that up. Does a high PSA level always mean prostate cancer? No. Who said no first?
Here's her shirt she gave.
I'm with the Padres.
That's my truth.
And so did I already ask, does an enlarged prostate always mean prostate cancer? No, it doesn't always mean prostate cancer. Who said no? Good. What is the main androgen produced in men? That's very good. Who said that first? Here I go, and I'm not going to throw this one. He had more problems than his prostate now. No, oh, I'm sorry. I saw the man in blue, not the man in black first. Okay, so you know a lot about your prostate, right? Okay, so what is that androgen called that's produced in your prostate? There you go, very good. And testosterone is what? It is, and it's the fuel for prostate cancer. So that's what raises your PSA for all of you just starting that journey. And do you know how prostate cancer is graded? Gleason and grade groups and no, you did it well. Very good. So there's a lot of information as you start your journey. There's a lot to know, a lot to take in, and that's what Navigators can help with, is bringing that information so that we understand it. Of course, the more you hear it, the more you learn. Then you move on to the next thing, which are treatment possibilities. And I imagine getting that diagnosis knocked the wind out of you, gave you pause. What's next? What's going to happen? And as you heard today, prostate cancer is treatable. In cases, it's curable. And people are living with it for 19 years. So that is something, it is part of what your life is. So the more you know, the better you can do. I can't tell you how nervous it makes you being here. Oh my gosh. Oh, that's nice. Thank you. So it's, oh, I know. And I can probably chase you all around too, and it'll probably be all right. So know your risk. It's important to know all the risk factors that can contribute to prostate cancer. Be aware, learn what you can. A reminder that September is Prostate Cancer Awareness Month. You are the best teachers and the best to tell people, talk to men, let them know what should they be doing. Are they having issues? Who should they talk to? How do you get tested? Simply a PSA test can give a lot of information. So really important to be an advocate, not only for your own care, but for teaching others as well. How is prostate cancer diagnosed? Some of you might be familiar with the digital rectal exam. I'm sure if you are familiar with it, you didn't like it very much. PSA blood test, not so scary there. After a PSA level might be a little high, your doctor might order an MRI on your prostate. That MRI can give a lot of information of what's happening. It might indicate that a biopsy is necessary. Have you all had biopsies? Yeah? You ever want another one? No? It's maybe not as bad the second time because you know what to expect. Micro ultrasounds can be very helpful in giving overall pictures, and there's lots of different scans that are available. Has everyone had a PSMA PET scan? Yeah, so that's a test for those that are starting their journey. A contrast material is injected into you, and it attaches to the PSMA proteins of prostate cancer, and it can give the doctor an idea whether or not your cancer cells are outside of your prostate. So that leads to different treatment options and different discussions there. What can you do? Well, there's a lot that you can do, and one of them is to keep a positive attitude, to surround yourself with people and information that's positive and helpful to you. Ask questions, be an advocate for your own health. Something else that I think is really important is to keep excellent records. It's good to know who you've talked to and when and the information that you've received. There is so much good information out there, whether that be online, like Prostate Cancer Foundation, Zero, which Aaron spoke about a little bit earlier. There's the Prostate Cancer Education Council, PCEC. So many resources, and one I'd like to tell you about, some you've attended. UCSD annually offers a meeting called the Prostate Cancer Patient Summit. This year it will be on January the 31st. It is a free program, but you do need to register. There is also a think tank that's available on Friday, January the 30th, for about 40 patients that want to participate. They're the ones that give us new insights, give us information on how we can reach patients, our treatments, anything that can help grow and build a better program. I absolutely encourage you to attend. There's so much great information, from understanding what prostate cancer is, what treatments are available, nutrition options, exercise options, support groups, information. It is a fantastic program. So I would imagine the registration will open in October, and you can just Google, and Aaron will put this on the website as well, UCSD Prostate Cancer Patient Summit. You can go back to the 2025 information and see, and I know a lot of you have attended it and also been a part of that think tank. So thank you for that, because it does make things better. Another great resource is YMCA, the Live Strong program. If you're on any treatment, but ADT, hormone treatment especially, it affects your body in interesting ways. Ask most women who've had estrogen changes in their life so they can give you a good hint on that. But it's important to stay physically active. So YMCA, it's the Live Strong program. It's a 12-week program. You meet twice a week. You make great friends, support that will be there with you. Try different forms of exercise, given some personalized programs for you. You can come back and work at the YMCA. It's a fabulous program, so I encourage you to just take a look at that. Something at UCSD, and I also believe at Scripps, is we offer a multidisciplinary department or appointment. It's a clinic where patients that are referred are able to see 3 doctors in one visit. That's surgical oncology, medical oncology, and radiation oncology. They go over what it is, where it is, what should we do about it. Prior to those appointments, the team that's working on that particular day, ours is on Friday. I think Christina's going to talk about their multidisciplinary as well, and I think you have more days for yours. But it's on Fridays, and if you're referred by one of the UCSD doctors, it's a very valuable meeting where your case has been discussed and 3 doctors do present to you. Great spot to ask questions, to learn more, and decide what treatment option is best for you. Another option at UCSD is we have same-day cancer care. So those that are on treatment, cancer treatment at UCSD, we have a cancer center that can see you same day or next day if you're having issues. So those are dedicated providers that can help with your cancer treatment issues that you might be having, anything that's happening, so you can see someone on the same day. As I mentioned, this is we have a lot of doctors, and this isn't even all of them. But so there's a lot, and I'm sure some of you I know that are familiar faces at UCSD have met some of our providers here. So a lot of different doctors. Erin had mentioned having an men's health, so a lot of good information there. If you prostate cancer treatment does affect your sexual health. It does change how things work, and it's important to have somebody help guiding that and how to move beyond that. So a lot of, and there's our multidisciplinary clinic. Again, you're referred from a UCSD doctor that feel that that's a good spot for you to be for your next steps. How do you become a patient at UCSD if you're not already, and if you'd be interested? Well, you just give our scheduling number a call, and I can tell you that number as well. It's 858-657-7876, and I'll go back to that slide. And you can register as a new patient. Certain insurance allows you to self-refer, though there is it's better through insurance if you've had a referral. So if you need more information on that, please let me know and I'll be happy to provide that. Prostate cancer awareness. This year's theme is United by Unique. And you may say, I want the same treatment that Joe had. He had prostate cancer down the street. Every diagnosis of prostate cancer is a little bit different and unique to the patient. So that's why you are unique. So give yourself a round of applause because you are unique. But your care should also reflect that. It should be personalized, and that's why it's important to advocate for yourself. It's important to research. It's important to look at complementary care that may be important to you. And just as an aside to that, if you are seeking other care and want to add that with your standard of care, if you're heading in that direction, always a good idea to let your providers know that you are, I want to explore this, or I'm trying that, or I'm taking this. It's important that all of those treatments work together, so just keep that in mind. And I know the patient that knows who I'm talking to right now, so, but I won't say his name. Anyway, cancer is a word, not a sentence. Forget all of the reasons it won't work and remember the ones that why it will work, and you're stronger than you think. There's a lot of support out there, and I know, again, gentlemen tend not to ask questions. They just kind of plod on with their health care. Ask questions. Be curious. Be engaged in your care. Be an advocate. If you need help, Navigators are there to help you. Your providers are there to help you. Your support groups are there to help you. So take great advantage of the resources that are available to you. Thank you for allowing us to be here today. I hope it's of some help to you. If you have questions afterwards, please let us know. And I think you get another viewpoint of what navigation is. Thank you, Erin.
Hang on just a second. Well, Why don't we go ahead and take just a couple of questions for Paula right now, things that might be on your mind about UCSD in particular. Larry, here.
Contact phone numbers and emails.
Oh.
So the contact number for UCSD scheduling a new patient is listed here. Afterwards, if you'd like more information, I'll be happy to give you one of my cards.
All right. Who else?
Are you two kind of in competition? Because I still don't understand the whole.
We're not in competition at all. I think it's important to note that we're so fortunate here in San Diego that we have so many terrific options for patients and so many facilities that are great. And we just want you to know that there are people to help anywhere that you go. I happen to think, as Christina probably will say about her space, I think UCSD is the cat's meow. I think our urology department, it's hard to get better than that with the research and the teaching and all that goes on with our learning, growing, studies, trials. But Christina will say exactly the same thing, so no competition.
If I'm with Scripps, and I am, and I can still come to UCSD?
Yes, well, and again, I want to just kind of qualify that insurance and that sort of thing. Yes, absolutely. And I think we would both encourage you to advocate for yourself, to get second opinions, to be where you're comfortable and the treatment that is best suited for you. So absolutely.
With respect to second opinions, I just want you all to know that when I was working with Dr. Dato, Paula was his nurse navigator. And I was, after I got my diagnosis, I wanted to say, you did Johns Hopkins. Okay, thanks. I wanted to have a second opinion through Johns Hopkins, and I found out through Paula and the people at Genesis that I could actually have a second opinion. I didn't know that was possible. So they emailed me the forms, and I looked at the forms, and it was like looking at Greek. The information they asked for, I didn't know if I provided accurately and so on. And so, and I'm a type A person anyway. So I called Paula, and I talked with her. And she said, okay, relax. I will take this on. And she filed the application for me, and they had to have samples sent from my biopsy and all that. She took care of all of that. And, the good news for me at that time was that they confirmed the diagnosis from Dr. Dato. So I felt like, okay, I know what I have, and now I need to figure out what to do. So I just want to thank you again, Paula, for your help.
You're very welcome, but I'd also like to say you're a type A+++ personality, and I think you had about 30 opinions, and you did a good job with your research. So yes, and you're very welcome.
Do you need the mic or?
Could you go back to the slide where you listed, I got a picture of the medical people, but the UCSD providers that are surgeons. Could you go back to that slide? So I want to ask you about one of them.
Uh-oh.
I'm sure you know all these people. I know one of them. And back to the beginning of the meeting, when Aaron was asking for future speakers, maybe my asking you here with witnesses could help you convince Dr. Juan Javier Deslodges to speak to us about IRE. Because every meeting, at least for the last 6 that I've been, the slide that comes up with what treatment you have, focal therapy is not as well known among all the others, and among the 3 or 4 options, IRE is not listed.
And what's IRE?
IRE is
Nanoknife.
electroporation, and if you can say that word, it means you've done some studying or maybe even had it. And the last thing I'd say is, when Aaron asked for hands up, there were only 2 people that had focal therapy today, and I'm one of them, and he was my doctor, and I just had it 2 months ago, and it was outstanding.
Is that actually considered a type of radiation or a type of focal therapy?
I'll give you my layperson's pitch. There's focal therapy, like the name suggests, does focal treatment. basically three, there's a couple of other ancillary ones, but you either kill it with heat or cold or electrical energy. IRE is the latter.
Okay, all right, gotcha.
And thank you, I will ask him. Dr. Desloges also does Tulsa, and as Aaron mentioned, focal therapy is an interesting, more up and coming, not that it's new, because HIFU and cryo has been done for many, many, many years, and not always in the United States. A lot of patients had it done in the Bahamas or other islands, and there is a place for it and a great candidate for focal therapy. And as you research more, you may learn more, but it's a very specific candidate for focal therapies. But Dr. Javier does IRE. He also does Tulsa. He's one of the 3 doctors at UCSD that does Tulsa, one being Dr. Bagrodi and the other being Dr. Liss. And I would say it'd be great if we could get Dr. Liss here as well, because he's doing studies and working on the microbiome of the gut microbiome, because he believes that that's where everything begins, and at some point we'll be able to diagnose prostate cancer just from your poop. Maybe avoiding those biopsies. And he has some great studies out there. You can go online and just look up Dr. Michael Liss and the gut microbiome. A lot of great information there, so I would encourage you to look at that.
All right, I've got a question. I'm going to jump in here first. This is a big list of doctors.
Yeah.
When I was basically told by my surgeon, whoops, maybe you should just go to Moore's and have them figure it out. I was faced with a list of people, and I didn't know how to pick a doctor. Luckily for me, Dr. McKay, I just started with Dr. McKay, and they said, sorry, we can't schedule anything. She's first got to approve you to be a patient to make sure that you are, above some threshold, which I was, because I was stage 4. But can you enlighten us with how do we go about choosing one of these oncologists? What happens if that oncologist happens to say no? What does UCSD do? It seems to me that if I was denied by Dr. McKay, they would have come back and just said, but tell you what, this doctor can see you 2 weeks from now. This is the way we're going. Can you comment on that?
So there's a decision tree that's part of scheduling. So you meet certain criteria and parameters. And Dr. McKay, as you well know, and you know her well enough, that her schedule is booked out for months and months and months. Dr. McKay is a pretty incredible medical oncologist, so that you meet certain parameters with Dr. McKay. So generally, if you are calling in or being scheduled, it would be with the first available. If you start with one, and the surgical oncologist also can be your regular oncologist. So let's just say you're seeing Dr. Bagrodia and you go through the multidisciplinary clinic. Whoever you see in that multidisciplinary clinic will then be your provider of whatever that pathway is. If you're not in the multi-D clinic, then let's say the Dr. Bagrodia or the oncologist, if you're going the route of medical oncology and radiation, you'll be referred, and again, that would be the first available at the time. And again, your situation moved you up that ladder a little bit, for better or for worse. I mean, you met with a pretty terrific doctor.
Yeah.
So it would be more first available if you're calling in. If I were scheduling for you, maybe I can adjust that a little bit or find someone if you had a preference. But saying who's the best doctor in here would be like saying who's your favorite child. And I know a lot of people might say, well, I really do have one. But this is an incredible group of providers. Every one of them is just incredible. So you would do well with anyone. Now, taking that one step further, we have our personalities and people that we kind of have a good vibrations with, and that all works out. So that may be one of your considerations. But if you're going by experience and expertise, every single one of these providers is pretty exceptional. Do I have ones that if it were me who I'd want to see? Yes, but that comes to a personal preference too. Larry?
What part does your primary care physician play in all this process? You talked about a referral, but is that who you get to make the referral your primary care, and that primary care can be at any of the hospitals or even private practice? Can you talk more about that, how to get that referral?
Yes, so your referral could be your primary care, or it could be your urologist if you're already seeing a urologist. And that referral, again, Medicare and certain PPO insurances allow you to self-refer. But when it comes to coverage later on down the line, that referral from your PCP or your urologist is really important to get that ball rolling. So yes, and if you had questions on those referrals, both of us could give you the particulars of how to have that done and where it's sent. And all your doctors, every doctor does referrals, so that's a pretty common thing in any practice.
Since Aaron just gave me the microphone, I'll go ahead and just want to mention my dad went in for lymphedema.
I met your dad at
Yes, I do recall. In 2018, he couldn't make it today. I had to go get a wheelchair for him. So it's getting worse. But I want to mention what was great about the question about competition. I wasn't aware in 2018 that the second opinion and all those options are available. And also the portals connect within one another. We were able to go to Sharp. We were able to go to see Dr. Rossi. We were able to go see Dr. Randall. We couldn't get in with Randa McKay. And that was all because of the second PSMA showing a severe progression. But I just want to let people know that information is accessible between all the institutions.
Of the big ones, that's correct. And anyone who participates in Care Everywhere, we can see a lot of those records. And to the point that you said, I just want to point out, oftentimes, and that doesn't usually happen at Scripps or UCSD, but let's say it's the mom and pop urology somewhere. They may just say to you, you have prostate cancer, let's get you scheduled for surgery, and next thing you know, that's what you've had done. And maybe there's not a lot of room for discussion or options. You're here and you're hearing all of this information and these stories. There's a lot of information out there. So make certain that you take the time to explore, to ask questions. Again, be engaged. There's a lot of good information, and you want to, again, be your best advocate. You know, there's all of us that can help, but it's really incumbent upon you to be learning, to be following up. And yes, you can have more than one opinion or two. It's your health, it's your care, it's your treatment. It's very important. And as you know, it affects a lot of things in your life. So you want to make the best decisions that align with your quality of life goals. It's really important. So surgery isn't the only thing, and radiation ADT isn't the only thing. I mean, in some cases, that may be true, but there are a lot of options out there, and I would just educate yourself.
Okay, why don't we take one last question before turning over to Christina?
Let me comment that what we're experiencing now and the resources available are just fantastic, because I am one of the people who survived cancer already for 16 years. And I engaged in that journey on my own. But I have to give credit to this group that when my Scripps urologist said, this is as far as I can go with you, you need to go to an oncologist. It just happened that a Scripps oncologist had given a presentation to this group, and he was just across the hallway from my urologist. And I'm following the journey with that oncologist, first class.
I need to make a comment. I need to make a comment because I think a lot of times men don't think they need to involve anybody else. So I think it's best if they think about taking their significant others with them, because you hear differently and you remember things differently. And if you don't go, then you're missing something.
Well, that, and you ask great questions that men don't ask. We had a gentleman in multidisciplinary clinic. I'll just give a little personal thing there. I came into the room to say hello and let him know how things would be going. And he's laying down on the the bed, taking a little nap. So he went to don't get up, just stay there, relax, be comfortable. His car had broken down on his way to the clinic. His wife was staying with the car. He walked to the clinic for the meeting. He didn't know all of this at the time, but he turned out to be Gleason 9. It was outside his prostate. He had just had his PSMA scan 2 days before, didn't look very good. So he was getting a lot of information for the first time, and I'm just going to talk a little bit about navigation there, because the first doctor that came in happened to be, the doctors rotate during that multidisciplinary, so it just, I don't know who you see first, it's just who's available at that moment. Anyway, it happened to be the radiation doctor, and he didn't, at that moment, realize that the gentleman didn't have all the information, so he came in and just started talking about the treatment pathway. It'll be radiation, it'll take this long, and then you'll have the different medications, and he's listening. And then the doctor left, and he was so confused about all of this. So we just started at the beginning. Here's what your tests have shown. Here's what they're talking to you about. Just take in the information. I take notes for them. And the sad part of that is he became suddenly aware that his treatment needed to start immediately, and that what was his priority was his sexual function. He had just been telling me, he had left his phone with his wife. They needed to use my phone. When she answered, because she's getting the tow, try to imagine all of this. He said, "Hi, honey." She said, "Hi, babe." And you realized right at that moment the connection, and it was very loving. And he was being told in that moment, and she wasn't present, that things will change for him, not only physically, but definitely sexually. And that was his primary. He couldn't believe that. And he said, "Can you tell me, is there just a natural way for me to do this, that I don't need to do any treatment?" And of course, everybody wants that moment. But anyway, he was very teary and very emotional. She wasn't there. She's waiting for the tow truck to come and pick it up. There was so much going on, and this was such a emotional and difficult moment. And this is where navigation can come into play, because the doctors are giving you a lot of information, and while they are caring about what's happening, there's an emotional side too. So it makes a difference to have someone when you need them. And then once you're on your way and with your good teams, then it's a lot easier, but at that moment it wasn't. So that's a prime example how navigation can help, and good for you for taking your journey in a great spot. So thank you.
Yeah. Thank you, Paula. And that was a great story to share at the end there. That kind of puts a lot of this in a whole new light even too. Next we have Christina from Scripps. Come on up. And it looks like it's working. Oh, that is at the beginning though, right?
Yeah.
Oh, I see.
So my name is Christina Cortez. I'm one of the 12 oncology nurse navigators at Scripps Cancer Center. For our genitourinary cancer program, we do have 2 navigators. One is me and one is my wonderful partner, Shannon. And it's a blessing to be here. So today I'm going to talk to you about oncology nurse navigation. Briefly, I became a nurse in Texas. I graduated from Prairie View A&M College of Nursing. I did my nursing residency and training at MD Anderson in Houston, Texas, and I was there for almost 10 years. I did work for a year at UCSD, and I've been at Scripps Cancer Center for 7 years. So my goal and objective is to educate you about what an oncology nurse navigator does and how they can help you within the prostate cancer journey. So an oncology nurse navigator is a professional registered nurse with oncology-specific clinical knowledge who offers patients individualized assistance to patients, families, and caregivers to help overcome healthcare system barriers. The ONN has skills and knowledge to coordinate quality patient-centered care through effective communication with an interprofessional cancer care team. Okay, so we have 6 key responsibilities and roles of an oncology nurse navigator. One is patient navigation and care coordination. We act as a cornerstone for our patient. We are a single point of contact for patients and their caregivers. We help patients navigate through the complicated healthcare system. We coordinate appointments, referrals, and multidisciplinary care in our multidisciplinary clinic at Scripps. And we ensure timely access to care and reduce delays in treatment. Another thing we do as a nurse navigator is education and information. We provide information about diagnosis, staging of cancer, treatment options. At Scripps Cancer Center, we offer 2 definitive types of treatment for prostate cancer. That's surgery and radiation plus or minus hormone therapy. And, you know, we help explain the diagnosis to patients and help with medical terminology because it's great to patients who are newly diagnosed. We also offer emotional and psychosocial support. We offer emotional support to patients and their families. On my initial call for a patient who's newly diagnosed with prostate cancer, I'm assessing whether they have social needs. I provide emotional support. And I also do an assessment to see if a patient needs assistance with transportation, safe housing, financial resources, or they're interested in male support groups. Most importantly, I'm an advocate for the patient's needs and their preferences along this journey. I make sure that their care aligns with their goals and values and support informed consent and shared decision-making. Resource and financial guidance. So we connect patients to resources such as financial aid programs, transportation assistance, housing, lodging, and we help patients understand insurance and billing issues, which is very complicated and a challenge even for me to understand. Survivorship and follow-up care assist transition into survivorship care plans, educate about long-term side effects, health maintenance, recurrence monitoring, and supports end-of-life care if applicable, like referrals to palliative care. Some common settings where an oncology nurse navigator work are hospitals, cancer centers, outpatient oncology clinics, community health organizations, and they also now have telehealth programs. I'm aware that at the big academic institutions such as UCLA, UCSD, they utilize nurse navigators. At Scripps, we have nurse navigators, 12 of them. Now, nurse navigators are used, there's a little bit of variance between institution about how nurse navigation is used. So, I navigate for the genitourinary service, which includes prostate cancer, which is a majority of our patients, kidney cancer, testicular cancer, and bladder cancer. So I work with our urology oncologist, who are mainly the ones that are working up the prostate cancer diagnosis. Briefly, it starts with usually an elevated PSA. You have a digital rectal exam. You have a prostate MRI to look at the lesion. If you have a suspicious lesion, then you proceed to a biopsy. And then depending on the cancer, the doctor would order a PSMA PET scan. That's usually ordered for our high-risk patients. And then Decipher testing in Artera, that's genomic molecular testing that we help facilitate for our patients as well. Okay, so providers' role in oncology care. So patients who are newly diagnosed with prostate cancer, this is very helpful. So when you meet with a urology oncologist, they're a surgeon. Radiation oncology will talk to you about radiation. Medical oncology, their role is prescribing and managing systemic treatment like chemotherapy, hormone therapy, and immunotherapy. Pathologists, they're a medical doctor who specializes in diagnosing diseases by examining cells, tissues, blood, and other bodily fluids. They play a behind the scenes but critical role in nearly all aspects of patient care, so they're very important. Along with the radiologist, who's a medical doctor who specializes in diagnosing and sometimes treating diseases and injuries using medical imaging techniques. We have 4 genetic counselors at Scripps, and they play a critical role in cancer care by helping patients and families understand their genetic risk factors that may contribute to cancer risk. Their work influences prevention, diagnosis, treatment, and emotional support. We have 2 great nutritionists, Allison and Farah, and the nutritionist role is critical and multifaceted, spanning from prevention and diagnosis through treatment, recovery, and survivorship. Proper nutrition, as you know, helps support the immune system, maintain body strength, manage treatment side effects, and improve overall quality of life for our patients. Social workers, we have 4 great social workers at Scripps Cancer Center. They address the psychological, emotional, social, and practical needs of cancer patients and their families. So having an oncology nurse navigator and an oncology social worker in your back pocket while undergoing cancer care at Scripps is very helpful. Okay, so we have a multidisciplinary clinic at Scripps Cancer Center. So every other Tuesday at Scripps Cancer Center in Encinitas, we have Dr. Ramsey Shashakli of Urology Oncology. He's a surgeon. Dr. Moonveer Bangu of Medical Oncology, and Dr. Patrick Linson of Radiation Oncology. And that's in the north. Every Wednesday and every other Tuesday at Scripps Cancer Center in Torrey Pines, which isn't too far from here, we have Dr. Ramdev Kanajetti of Urology Oncology and Dr. Jeffrey Zaitung. For our medical oncologists, we have Dr. Moonveer Bangu. And for our radiation oncologists, we have Dr. Prabhakar Tripurnini and Dr. Patrick Linson of Radiation Oncology. For the clinic in the south, which is Scripps Prebis in downtown, we have Dr. Carol Salem, who's a surgeon, Dr. Shane Mesko of Radiation Oncology, and Dr. Paulette Gabai-Saldate of Medical Oncology. Just wanted to let you know that Scripps has many other oncology experts in GU oncology who are not in the multidisciplinary clinic but are just as great. But due to their scheduling, they're not in the multidisciplinary clinic. Okay, how can I be seen in the multidisciplinary clinic? Well, it starts from a referral from the Scripps urologist or a Scripps medical doctor, like the primary care. You can self-refer. We also get outside referrals. And then also we have transfers of care or second opinions. To become a Scripps patient, you contact 1-800-SCRIPPS to get registered as a new patient. Please make sure that your insurance is covered and within your network, just so there's no barriers to care. Cancer care is very expensive, so you want to make sure that wherever you get care, you're covered. Does anyone have questions? Thank you.
Thanks. Do Scripps doctors ever refer patients to the Proton Center for proton radiation?
Oh, yes, they do. I know we refer to Dr. Carl Rossi of California Protons, who has a partnership with UCSD.
Good question, good question. Other questions for Christina? Yeah.
The nutritionist at Scripps.
Try to do it again?
Yeah. The nutritionist at Scripps, could we get their name or contact?
Sure. So one is Allison Mieger and one is Farah Paloma. And all you have to do is contact the Scripps Cancer Center and ask for a referral to nutrition. So our cancer center's website, number is 8. Do you want to write it down?
Yeah,
Go ahead.
I'm a Scripps patient,
Okay.
and you're my
counselor, whatever you call it.
Okay.
So I think you'll be getting an email from him asking too.
Okay. What's your name?
Matthew Allen.
Okay. Okay. Hi, Mr. Allen. Nice to see you again. Yeah. Well, just contact me and we could put in a referral to oncology nutrition, either Allison or Farah. They're great. Our nutritionists, they do virtual visits, which is more convenient. If you'd like to meet in person, they will also meet you in person as well. Whatever works best.
One more here and then I'll come over there.
Hi, Christina. It's been a while.
Hi.
Insurance question. I'm soon or some point in the future going to be transitioning from private insurance to Medicare. Are there any general lessons learned or things that people, and I'm probably not the only one in that category, should be aware of as I go through that transition?
That's always a challenge. I'll be quite honest, I don't know all the nuances of insurance, but I know that when patients have Medicare, their scans and care is expedited more faster than the HMOs and certain PPOs. So I think Medicare, if you're going to transition to Medicare, that's great. I never have an issue with patients who have Medicare getting scans or getting treatment. There's no delay.
Good question. Yeah.
I was in private insurance and went to Medicare last year, and it was smooth. But there's no issues whatsoever. That was with UCSD, but my guess is they're all similar.
Thank you. Christina, thank you. Earlier, you gave me a great recommendation, and
My
that was
pleasure.
for my father, who's now in a wheelchair. You said I could contact our Dr. Manvir Bangu and ask for a referral to palliative care.
Yes, ma'am.
And my question to you then is, would that include, would those people you mentioned, be able to help me with like transportation assistance?
Yes.
Okay.
So palliative care is a comprehensive program where it consists of doctors, nurse practitioners, palliative care nurses, and social workers. So they can help you with any type of social issues and just home care, things like that.
Thank you. I'd just like to make a comment, information that might be useful to some people around here.
Sure.
Dr. Bangu is my oncologist, and when he decided to prescribe a certain drug for my use, he coupled up with a pharmacist. There is a specialized pharmacist, and he took very careful care of making sure that that everything was correct in the other drugs that I was taking, and that I can take that particular drug. And then he monitored how that drug was doing with me. And so I had frequent blood tests and determined at one point that I was getting a higher dose than I was supposed to get because my liver started to be affected. And so I just wanted to mention that this is extremely important when you're getting some of these very powerful drugs, that you also have the benefit of a specialized pharmacist like that.
Yes. So patients at Scripps who are in treatment and they get they're newly prescribed a medication to treat prostate cancer. The oncologist does work with the PharmD. There's a consult with the PharmD before you start the drug. And also with Dr. Bangu, with medical oncology, for patients who are in treatment, the doctor works with a nurse, and at Scripps, they're called a treatment nurse navigator. So at Scripps, I'm an intake oncology nurse navigator. So basically, my role is for patients who are newly diagnosed with prostate cancer. I help facilitate their care and testing into the multidisciplinary clinic, and I make sure that their care gets expedited to treatment efficiently. When patients are already in treatment or they're about to start treatment, they meet with the treatment nurse navigator, which would be if you're getting radiation, the radiation nurse, and if you're getting, hormone therapy, it would be with the treatment nurse navigator with oncology. And a lot of the times, depending on your care, you can have multiple navigators involved in your care. So, when you establish care and rapport with your treatment team, make sure you get their name, a good contact number, and the best way to reach them, and to get their business card, because there's a lot of moving parts in cancer care, right? You have surgical oncology, radiation oncology, and medical oncology. And sometimes you only need one service, and sometimes you need two or all three. So it's really good to, keep a notebook and start taking names of who's in your treatment team. And for instance, the PharmD, you're able to contact them too if you have any questions or concerns regarding your treatment. And if you're experiencing side effects from treatment, make sure you contact the treatment nurse navigator who's working directly with the oncologist so they can relay the concerns expeditiously to the care provider.
I want to jump in here with a comment for a minute too, because we've seen lists of doctors up here, and that's perhaps all that we're thinking about is what doctor I'm seeing. But and sometimes maybe not in cancer and in whatever else, we'll try to go to a specialist, and somehow we get kind of pushed off to someone else, a physician assistant or something like that, and we don't think that we're getting the care that we expect. I have been incredibly impressed with the nurses that I've gone to. I'm not allowed to go in and see Dr. McKay every single time, and let's face it, I don't need to. I get my blood tests run every 6 months, and I go in and I see Archana. And she reads through the blood tests, and she knows everything that's needed. I've been very impressed with the level of nurses, personally, that I see at UCSD, and I hear excellent things about the Scripps doctors and the nurses as well. So don't shy away from if you're not getting in directly to see the doctor, that the nurse is not going to be able to have a huge amount of experience with whatever question you have.
So that's a good point. Another thing at Scripps is if you're having a hard time getting a hold of your provider. For instance, if you're trying to get a hold of one of the surgeons because you're having an issue and you've contacted them through the portal and you've contacted them through the phone and you're not getting your questions or concerns answered expeditiously, the role of the nurse navigator is to help facilitate that communication. So it's always good to, like I said, to have a nurse navigator in your back pocket.
And when I was pushed off at Genesis Healthcare years and years ago, when I called up and I said, I'm bleeding into my catheter right now and it really hurts. And they were like, well, we can make an appointment for you to see the doctor in 2 weeks. Somehow along the way, not that I knew it or I can't even remember how it happened, but basically I walked in and I saw a physician assistant and they knew everything that needed to be done. So it's like, I think these ladies here are the type where they'd be like, oh, you're having a problem with that? Let's get you to a solution that will work for you. Go to Bill.
I have also another complex case manager who works for the Scripps Healthcare Plan Services. Mm-hmm. Maybe you could elaborate a little bit on that aspect, because we were talking about the insurance, mm-hmm. and I have an HMO, but then I'm seeing doctors outside of Scripps because they have specialties that Scripps doesn't offer. Mm-hmm. It gets to be complex, and I think with some of the changes in the insurance that might be coming next year, mm-hmm. going to be more complex.
So I don't have a lot of experience working with a complex case manager. I know that they exist, and that if there's any very complex insurance concerns, then it's escalated to that. But I don't work directly with them. So usually the insurance concerns are usually worked out before I get the patient. So meaning that if there's a new referral, that already means that their insurance is accepted. And so I get to just concentrate on navigating them through the continuum and not having to worry about the insurance issue. For insurance concerns, we have an AQP team that helps patients with complex insurance concerns, but that usually is worked out before it gets to me or to one of the nurse navigators.
What's the name of that?
AQP, and to be quite honest, I forgot the acronym for it, but it's professionals who are well-versed about helping patients about complex insurance concerns. Yeah.
Can you give us your contact phone number and your email? I've been trying to contact you for the last week, and they never even heard of you, unfortunately. That's why I'm asking this question.
Yes. To get referred to a nurse navigator or with oncology, nutrition, or social work, you would contact the Scripps Cancer Center, and the number is 858-626-6756. Before I forget, AQP stands for Access Quality Program. Yeah, okay.
But by the way, before the next question, I tried to contact you directly through the Scripps system, and it was a little bit difficult for me to. But yeah, because like I finally called the front desk and said, "Hey, I'm trying to get a hold of you," because I think that was when I had the wrong email address for you or something.
Hi, Christina.
Hi.
Terry Ritker's here.
Hi,
and
Terry.
you're my navigator.
Yes.
And I just want to say that I want to thank you. I haven't been involved very long in the cancer journey for treatment, but you've been very responsive and just easy to get a hold of, and thank you for that. So
Thanks, it's my pleasure. Your care is very important to me.
thank you.
I love all of my patients. I look at each patient as either could be my husband, my father, or my grandfather. So you're just not a patient to me, you're like family. So thank you.
Thank you. And I have a question. Yeah. I have a question for you. So I went to the multidisciplinary meeting, and I'm not sure if it was your PowerPoint or yours, that it looked like there were 3 different types of providers in it: radiation, surgery, and was it medicine?
Medical oncology.
Medical oncology. And mine only, I think, had 2, the radiation and the surgery. Is that because of my profile?
Yes, sir, it is. So for patients with high risk and very high risk disease, medical oncology is warranted. For patients with low-grade disease or intermediate, meaning a Gleason 6 or a Gleason 7, you usually don't need medical oncology, but there are certain parameters where if you're a Gleason 7 but your PSA is above 20, you will see a medical oncologist. So every patient's care is very personalized and individualized, but that's a very good point and
Thank you.
question. Yes.
This number you gave me, that's not your number.
No, that's to become a patient, so
One is your number and your email.
I can give that to you after.
Afterwards?
Yes.
Okay, because I've been having a hard time with this.
Are you a Scripps patient?
Oh, big time, big time.
Okay. Okay. I feel like we've met before. But I'll give you my contact information afterwards, yes.
couldn't reach you either, and that's why I asked you the question before.
Oh, okay, so that number that I gave you is to the cancer center, and my coordinator answers those calls, so.
No, I didn't even know about that number until you gave it to me earlier.
Oh, okay. So at Scripps, we have many different departments, but the Scripps Cancer Center is that number I provided you, which is the 858-626-6756.
All right, any more questions? All right.
So it's really great to have these nurse navigators and multidisciplinary teams for prostate cancer. Do they also exist for other types of cancer?
Yes, that's an excellent question. So there's 12 nurse navigators at Scripps Cancer Center. And for instance, we have a breast cancer multidisciplinary clinic where the same thing, if a patient's newly diagnosed with breast cancer, they meet with the treatment team, and that can consist of, the surgeon, the radiation oncologist, and medical oncologists. So we do have that for breast. We do have that for liver cancer, prostate cancer.
Colon cancer?
Colon cancer, yes, thank you. Yes, there's a multi-D clinic for colon cancer at Scripps Cancer Center.
Okay, thank you.
All right, any last questions? Okay, one more from Larry, and then I think we're going to wrap up the meeting here.
Larry.
Okay, I have doctors at both Scripps and at UCSD. And one of the important things that you want to have happen, for example, all my blood tests I do at UCSD. I don't want to get stuck twice at both places. So the people at Scripps said, it's fine, you can have it done at UCSD. However, when I go to see my cardiologist at Scripps, he's not able to get access. And supposedly people say, well, both places are on Epic. They all share. Well, he's not able to get to those blood tests. And I call the technical support for my chart, and they're of no help either.
Yeah.
But this Epic system is supposed to connect all of this, and it's not working.
So maybe the provider doesn't know about how to access Care Everywhere, because there's certain buttons that need to be.
That's the Care Anywhere in the media is two different things. That is not Epic.
So, okay, so Care Everywhere is if you have labs or any testing and your visits at UCSD, I can see all of that. But if you have your labs performed at a LabCorp or a Quest Diagnostic, and then
UCSD.
Okay. I haven't had any problems accessing labs. Everything's transparent through the MyChart system. So
who's the
I.
expert at Scripps that we could have talk to the doctor that's
So,
having problems?
so usually the doctor has a nurse who is able to pull up the labs. That's what I do for my doctors. I don't know why.
It's been this way for a year, but anyway, enough time.
Interesting.
All right, how about another round of applause for both Paula and Christina? I really think we've learned, you were all done, right?
Oh, these are just some of my helpful websites and resources that I like to tell my patients about. The Prostate Cancer Foundation website's excellent. There's a lot of webinars for patients. There's virtual support groups. If you're newly diagnosed with prostate cancer, I know a lot of our patients go to Google or ChatGPT or DeepSeek, but Prostate Cancer Foundation is an excellent and solid website for information about prostate cancer. Then you have the Prostate Cancer Research Institute, which I did go to that meeting and it was excellent. They have a lot of helpful information and videos on their website. Zero Prostate Cancer, Triage Cancer. Triage Cancer is very helpful for patients. They help educate patients who have cancer about coverage regarding insurance, and they have a lot of resources. National Cancer Institute and American Cancer Society. Thank you.
Sorry, I cut you off there. We had so many questions going on. I was just thinking we were in Q&A. Thanks for coming, everyone.